Well, I'm getting excited here because in just a couple of weeks, Doc's new book is coming out. It's called Epigenetics. The subtitle is The Death of the Genetic Theory of Disease Transmission. The Death of the Genetic Theory of Disease Transmission. And this is very exciting stuff. This goes back a long time. I've been dealing with this for 52 years and finally have unimpeachable evidence that diseases are all kind of connected here. For instance, everybody knows that a calcium deficiency can cause 147 different diseases, and most of them people know. Osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis. Calcium deficiency can result in kidney stones, bone spurs, calcium deposits, periodontal disease, loose teeth. When you get osteoporosis of the face, it's called periodontal disease. It's a different disease name, but same disease. And then you can get high blood pressure. You can get insomnia. You can get blood clotting problems because calcium is required as one of the cofactors necessary for the clotting proteins to work. Yep, you get people who nick themselves shaving. They just bleed and bleed and bleed and bleed. They have terrible blood calcium deficiencies. And then there's hyperparathyroidism. Doctors want to surgically remove your parathyroid gland. That's just a simple deficiency of calcium. And then you have things like ankylosing spondylitis, where you have a sort of welded chain effect between all the vertebrae in your back. You lose your ability to turn. Doctors want to do surgery on that one. And it's all simple calcium deficiency. Muscle cramps. That's right, just simple muscle cramps. Calcium deficiency, insomnia, all the stuff. It's just really wonderful. There's actually some hyperactivity. Anxiety attacks can be caused by calcium deficiency. So it goes on and on and on and on. So I want you to think of beri, congestive heart failure, dementia. How can they be related? Well, they're all caused by a deficiency of thiamine, vitamin B1. That's right. I've gotten rid of congestive heart failure in people who've been on the heart transplant list for 3 years and 5 days. Their cardiologist took them off the heart transplant list, took them off the 27 prescription drugs because it was a simple thiamine, vitamin B1 deficiency, and they gave them 28,000 times the minimum daily requirement of thiamine, B1. Amazing stuff. Well, the same thing is true when you look at muscular dystrophy, cystic fibrosis, and sort of what's called an acute inclusion body liver necrosis, or death of the liver. And this is where selenium, the trace mineral selenium, was determined to be an essential nutrient back in the 1950s, 1957, 1958, by a guy by the name of Klaus Schwartz. And Klaus Schwartz has just been one of my heroes for a long time. Of course, I discovered the first non-human case of cystic fibrosis in a monkey back in 1977 at the Yerkes Primate Center in Atlanta, Georgia, attached to Emory University and NASA, the National Aerospace Administration. And I got fired for saying, hey, this disease, cystic fibrosis and muscular dystrophy and that sort of stuff, is not genetic. It's a simple deficiency of the trace mineral selenium. Selenium deficiency can cause goiter. Selenium deficiency can cause anemia. Selenium deficiency can cause liver disease, including all kinds of liver cirrhosis. I've gotten people off a heart transplant list. At Harvard Medical School, they did over 13 operations on them, put in 32 stents into their liver, and they carved their liver down to where it was the size of an Oreo cookie, and I rebuilt it in just 3 months using the 90-plus extra selenium. And, of course, I threw in a gluten-free diet to make sure this lady could absorb everything. And, of course, they didn't want to hear why all this worked. Well, again, here's selenium. A trace mineral deficiency can cause, let's see here, liver death, liver cirrhosis, liver necrosis, liver death, cystic fibrosis, a disease of the pancreas causing malabsorption problems, gluten intolerance, and then there's muscular dystrophy. We've known about selenium deficiency and muscular dystrophy, again, since the 1950s, but medical doctors keep insisting that it's a genetically transmitted disease. Not true, just a simple deficiency of selenium. And, of course, you throw in deficiencies of other nutrients, and you get other complications that go along with it, and they call it other diseases, where you have multiples of deficiencies, and you get sort of a different pattern, and they give it all various names. And these are really just nothing but nutritional deficiencies. Every birth defect you can name, including things like cerebral palsy, Down syndrome, cleft palate, cleft lip, spina bifida, homosexual behavior, hermaphrodites. These sorts of things are all caused by nutritional deficiency of the embryo in the first couple of weeks or couple of months of pregnancy. This is pretty easy stuff. We've eliminated all these diseases in animals, simple supplementation. And I began doing this on myself when I was 9 years old. As a result, here I am going on 75. In a couple of weeks, I'll be 75 years old, using the Chinese system of aging. And guess what? I haven't been to a doctor, with me being the patient, in 67 years. I have not been on a prescription medication ever. I do not have any health problems whatsoever. It freaks people out. Well, I'm very obsessive about avoiding the bad things. No fried foods, no processed meats or nitrates, nitrites, no oils, and no glutens. And most people think I'm in my 50s when they look at me. And, of course, I'm 25 years older than that. I'm 50% older than they think I am, simply because I've been taking this stuff twice a day. I've been taking the entire 90 for my body weight twice a day since I was 9. Now, I played heavy sports. I played football, played the middle linebacker on defense. I played pulling guard on offense and football in junior high school and high school. I wrestled in junior high school, and college. Really did a lot of heavy weightlifting to be in shape for the wrestling and the football, and never had any problem, never had any injuries, all because I took the 90 plus extra selenium. I want you to be healthy too. And look for the new book coming out, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and we'll be back with Dead Doctors Don't Lie after these messages. Okay, let's see here. We have Billy sitting in today for Doug. Billy, what pearls of wisdom do you have for us?
Well, let's start the whole thing off with this. And that is because a new study says that vitamin C shows promise as a cancer therapy. Where have we heard that one?
I don't know. That sounds new and outrageous to me.
Sounds awfully familiar to me. Intravenous vitamin C combined with conventional chemotherapy can kill cancer cells. The University of Kansas Medical Center has reported in a study of 27 patients, not a very big study by admitting, but newly diagnosed with stage 3 or stage 4 ovarian cancer, researchers found that patients who received a high dose of intravenous vitamin C along with conventional cancer therapy experienced fewer toxic effects from the chemotherapy drugs, which is, half the battle when you're getting all that poison.
Exactly. Well, see, the problem with chemotherapy drugs, Billy, is that they not only kill the bad cells, they also kill the good ones.
Indeed. Well, researchers also conducted a rodent study and observed that an intravenous infusion of vitamin C was able to kill cancer cells without noticeable toxicity or pathological changes in the liver, kidney, or spleen, all very important because that, of course, gets attacked in the whole thing as well. So vitamin C was used in the 1970s as an unorthodox therapy for cancer. It is used by complementary and alternative medicine physicians, but conventional physicians remain skeptical about its therapeutic benefits. This study, published in the Science Translational Medicine Journal, aimed to determine the cellular mechanisms by which pharmacological vitamin C has a therapeutic benefit in cancer. So that's a fancy way of saying it might work.
Yeah, well, I find it kind of interesting, and of course that goes along with everything, and that's why I'm so excited about this new book coming out, Epigenetics, Billy, because they poo-pooed me since the 1970s when I said that cystic fibrosis was caused by selenium deficiency, and in the 60s I said muscular dystrophy was caused by a selenium deficiency, and they thought I was just sniffing glue. Well, guess what? We have unimpeachable proof now. It's as predictable as gravity. We've reversed genetic markers. We have blind studies where the hospitals and the doctors didn't know what we were doing, and they said, oh, wait a minute here, maybe we made a mistake. These guys are all negative now. And so this is heavy stuff.
Well, I wanted to just add this because according to one of the researchers, Dr. Janine Driscoll, we quote here, "We now have a better understanding of vitamin C's anti-cancer action, plus a clear safety profile and biological and clinical plausibility in a firm foundation to proceed." Basically what you're saying is the vitamin C is safe enough for us to actually try.
Well, yeah.
There you go.
They forgot that it's an essential nutrient to prevent scurvy.
That's the other thing I've never understood. There are various things we know for sure prevent disease or even cure disease once you have it. One of them's vitamin C, and the disease we're talking about associated with that for sure, the evidence is overwhelming, is scurvy. Yeah. If you have scurvy and you take vitamin C, it goes away.
Yeah, and you take it and you prevent it. And, of course, it used to be taught. I don't think it's taught anymore in school, but it used to be taught when I was in school that, you had an iodine deficiency, you got goiter. You had a vitamin C deficiency, you got scurvy. You got a vitamin B1 deficiency, you got beri, and that kind of stuff. You got vitamin A deficiency, you got skin problems and birth defects, and you went blind and so forth. Today, in health class, the only thing they teach kids is how to put a condom on a cucumber.
Well, I suppose that's the way to start.
Yeah, well, of course, the American people are just totally ignorant. I mean, I talked to a group of people who the average age is, 25 to 40, and I ask them these things, and they look at you like, scurvy? What's scurvy? Okay, we got to start at the beginning here, folks. Well, thank you so much, Billy, for bringing that up. Thank you so much, everybody. And stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Billy, let's go to callers.
All right, Doc, let's head to Pennsylvania. And Antoinette, you're on with Dr. Wallach.
Antoinette, you're on the air.
Hi, Dr. Wallach.
Hi.
I'm calling for my brother who's 47 years old, and at 46 he suffered a heart attack. It was congestive heart failure, and it has to do something with his valves not working properly. That led to him having a massive stroke. He had blood clots on both sides of his brain, and now he suffers seizures.
Okay, now wait a minute. Stop there a minute. How long had he been diagnosed with congestive heart failure?
The first time I heard it was he had another heart attack in October of this year, but the first one was April of 2012.
Okay.
I mean, October of last year.
Had he been under treatment for heart disease before he had his first heart attack?
No. He was only diabetic. No high blood pressure, no heart disease, none of that.
Mm-hmm. Yeah. Well, congestive heart failure is a deficiency really of a single vitamin. And, of course, the heart gets bigger and bigger and bigger. It gets like a big basketball in your chest, and the valves don't meet properly and set you up for all kinds of stuff. But the congestive heart failure is caused by a single deficiency of a vitamin. Type 2 diabetes is caused by a deficiency of a small cluster of minerals, and it's all preventable, all reversible with nutrition. So your brother's doctor really should go to jail. Now, tell me, let's jump back to your brother here.
Mm-hmm.
How's he doing now? He's in the hospital? He's at home or what?
No, he's home. He actually had a seizure yesterday, but it was a mild one. He went to the hospital. He's back
And what
home.
did they say? What did they say caused the seizure?
They're saying because of the damage to the brain from the stroke, that's why he started having seizures.
Okay, how much does your brother weigh?
200 pounds.
Okay, well, he's got to get rid of bad stuff. With a history like your brother's, because he had a history of congestive heart failure, needs to stay away from sugar, because sugar makes a deficiency of that vitamin worse, makes congestive heart failure worse. Also can cause all kinds of metabolic problems. Deficiency of this one vitamin can cause metabolic problems in the brain and cause memory loss. Does your brother have any memory loss?
Yeah, he has what they call aphasia, like he has trouble with comprehension. And
how long did he have aphasia? Was it after the stroke or before the stroke?
After the stroke. After the stroke.
Okay. And it can also cause congestive heart failure. It can cause all kinds of metabolic problems all over the place, including the liver and so on. So what I would do is get your brother... wait a minute. Now, did you have asthma or did your brother have asthma?
No, I do, but he doesn't.
Okay, well, guess what?
He has bad allergies, though.
Okay, guess what? Hang on here. Shar, what's the basic family's problem here?
A gluten intolerance, no question about it.
Yeah, gluten alert.
Yep.
And it shows up differently. And how many different presentations have you seen, Shar, from gluten intolerance?
Oh, God, it's a lot.
Remember the gal up in Canada? How many diseases did she have, one person?
22. 22
different diseases, and she had a gluten intolerance. Why would she have 22 different diseases? Is it genetic?
No, because she keeps getting more diseases because she's unable to absorb any kind of food or nutrients.
Ah, very good, very good. You get an A+. Well, basically, this is your brother's problem because you got it, he's got it, all your kids got it. Okay, Billy, let's go right back to Pennsylvania and Antoinette and Shar. Her brother is 200 pounds, has a history of congestive heart failure, stroke. What would you do for this guy?
He needs 2 of the healthy brain and heart packs, and he needs some de-stress for the congestive heart failure.
Okay. And, of course, with the 2 healthy heart and brain packs, would be 2 bottles of selenium, 1 each. And because he weighs 200 pounds, I'd go ahead and get him an extra bottle of selenium, too, so he could have a third dose of 3 selenium a day, so it'd be 3 at breakfast, 3 at lunch. Or, excuse me, 3 at breakfast, 3 at lunch, 3 at dinner, and then 2 full doses of everything from the 2 healthy heart and brain packs. And then what would you do for a diet for him?
Oh,
Antoinette and all her children.
He absolutely has to be on a gluten-free diet, no question about it. It's drop dead.
Absolutely drop dead. I mean, even the dog and the cat and the fish and the bird, anybody in the household with him has got to be gluten-free because of cross-contamination, the food preparation surfaces, beds, laundry, couches, and all that kind of stuff. Give us a call every couple of weeks. Let us know how he's doing, and we'll go from there. Okay, Billy, let's go to callers.
All right, Doc, let's head to Tehachapi, California, and Duncan. You're on with Dr. Wallach.
Oh, Duncan, you're on the air.
Hey, Dr. Wallace.
Yes, sir.
I have ulcerative colitis, and I'm now 21 years old, and I've had it since I was 12.
And how old are you now, sir?
21.
Okay, do you have any other issues? Any skin issues? Any skin issues?
No, but I've been losing a lot of blood over the years. Sure. I've had 3 blood transfusions.
Okay. Did you have any? Do you have any asthma or anything?
No.
Do you have any brothers and sisters?
Yes.
Do any of them have asthma or skin issues?
My brother has asthma.
Uh-huh. Okay, Shar, what's going on here with Duncan?
Gluten intolerance. It's an epidemic right now. It's really getting bad.
Yeah, there's basic things that are caused by gluten intolerance, Duncan. One is celiac disease, diverticulitis, colitis, ulcerative colitis, Crohn's disease, irritable bowel syndrome, inflammatory bowel disease. So ulcerative colitis with blood and mucus is very typical of a gluten intolerance, and it causes chronic progressive, it gets worse, malabsorption. And so it's not unusual for families, because women pass it on to all their kids. Men get it, but men don't pass it on. It's not a genetic thing, but it is passed on through cord blood and through breast milk. How much do you weigh, Duncan?
And I've been diagnosed with ulcerative colitis.
Yeah, how much do you weigh?
175.
Okay, Shar, what diet would you put Duncan on, and what would you give him?
Okay, he probably should have a, oh boy. 175. Yeah, he needs 2 healthy start packs. The 2.0, he needs the 2.0 because of the gluten.
Okay, perfect. 2, I'd go, with 2 healthy, 2 healthy start packs. That would be the 2.0, right? And so that'd be drop-dead gluten-free. Absolutely no gluten, no wheat, bran, oats of any kind, no cereals, pasta, and all this kind of stuff. We do have Valerie's gluten-free cookbook if you're into cooking, Duncan. If you're not, most grocery stores do have 1 or 2 gluten-free aisles because, as Shar points out, it's such an epidemic now. It's a big profit center for grocery stores. Tell your brothers and sisters about it and save them. Get back to us in 2 weeks after you start the diet and the program. We'll walk you through this. We'll be back after these messages.
All right, Doc, let's head to Atlanta, Georgia, and Clarita. You're on with Dr. Wallach.
Clarita, you're on the air.
Wallach.
Hi. How can we help you?
Rita, and I'm calling, for my husband, Donald.
Okay.
Donald suffered a stroke in 2010, and he had to have a craniectomy and a cranioplasty.
Mm-hmm.
He's now taking...
So wait a minute. It was a bleeding type stroke.
He had it from AFib.
No, that's not what I asked you. It's a bleeding. He had blood under his skull, so that's why they did the skull thing, right?
Yes.
Okay, so it was a bleeding type of stroke, okay?
Mm-hmm.
It was a bleeding stroke.
Oh.
It wasn't a blood clot stroke.
No. Well, they said he developed clots because they had to put in the mesh, the mesh that
it traps the
blood clot from going up to his brain.
Mm-hmm.
A filter.
Yeah, I understand.
And he's now taking Keppra, 500 milligrams, amiodarone, 200 milligrams,
mm-hmm.
folic acid, 1 milligram, lisinopril, 20 milligrams, and warfarin sodium, 6 milligrams, 5 days a week.
Yeah, he's a walking pharmacy, isn't he?
Yes.
Yeah, so how much does he weigh?
Donald, he's 6'3", and he weighs about 240.
Now, do any of those drugs he's getting, any of those pharmaceuticals, if they're missing out of his life, do they cause a disease? In other words, are they a nutrient? Are any of these drugs a nutrient?
No, I don't think so.
One of them, folic acid, is.
Mm-hmm.
And the reason why they give that, because a couple of those drugs actually interfere with folic acid metabolism, so they're throwing folic acid in to make up the difference.
Okay.
Okay? But folic acid does not prevent blood clot strokes.
Mm-hmm.
Blood clot strokes are not caused by folic acid deficiency.
Mm-hmm.
Okay? Shar, what causes blood clots?
What causes blood clots? A lack of essential fatty acids.
And omega-3 essential fatty acid deficiency. Very good. So, a guy's 6'3", 6'4", weighs 240 pounds. The first thing we have to do is get him on all 90 essential nutrients. And since all this is going on in the brain and his blood vessels, I'd give him 2 as a minimum. He could use 3, but 2 would be fine. Of Shar?
Of healthy heart and brain pack.
Perfect. That's a A+. Exactly, because he's got vascular stuff going on here, and he's got brain stuff going on here. So I'd give him a minimum of 2, maybe even 3, the healthy heart and brain packs. A full dose of everything at breakfast, a full dose during a dinner, and if you get 3, a full dose of breakfast, lunch, and dinner. And, of course, it's imperative that he get rid of the bad stuff. No fried food, no processed meats, no oils, no margarines, no mayonnaise, no salad dressings, no cooking oil, no gluten, no wheat, barley, rye, and oats. And, of course, with the 2 healthy heart and brain packs, or the 3 healthy heart and brain packs, whichever set you go with, there's EFAs and EFA pluses. So he's going to get plenty of the omega-3s, the right ratios of omega-3s, 6s, and 9s, and that will reduce the risk significantly of, and that's one of the things I sued the FDA over, was being able to say that we could prevent and reduce the risk of thrombotic stroke, blood clot type of stroke, coronary thrombosis, blood clot artery disease in the heart, and also pulmonary embolism and deep vein thrombosis by supplementation with omega-3s and right ratios of omega-3s, 6s, and 9s. And so Char's exactly right. So we'll do that. And, of course, the thing that doctors worry about is, oh, you're giving him all those omega-3s. He's getting warfarin. He could bleed to death. No, what I know he goes in on a regular basis to the doctors and have his blood clotting time checked. And so it begins to get a little long, just instead of them saying, well, he's eating too many green things, he's getting too much vitamin K, and we need to get rid of all the green things. I was saying, no. What I want you to do is reduce his medication a little bit. As long as his blood clotting time's in the normal range, he does not need vitamin K. Okay? What he does need, though, is the omega-3s. Vitamin K doesn't, he does not need warfarin. He does not need warfarin. Warfarin is a blood thinner, but it doesn't replace vitamin K, and it does not replace the omega-3s. And so I would rather slowly wean him off the warfarin based on actual blood laboratory tests by the doctor. Let the doctor wean him off of it and to take the 90 essential nutrients. Okay, give us a call every couple of weeks, Clarita. Okay, Billy, let's go to callers.
All right, Doc, let's head to New York and Carol. Carol, you're on with Dr. Wallach.
Carol, you're on the air.
Hi.
Hi, how can we help you?
Oh, thank you. I'm calling about my husband. He's had arthritis and ganglion cyst on his wrist for about 3 years now, and we're wondering if, what we could do to help that.
Okay, well, first of all, ganglion cysts are kind of related to arthritis. It's a breakdown of the tendon sheath, and they're called ganglion cysts on your wrist, and behind your knees are called Baker's cyst, but it's all caused by stretching of that, almost like a joint capsule that covers tendons and ligaments, produces synovial fluid so that they move around without squeaking and being painful. And when they get a breakdown of the elastic fibers in them, you get kind of almost like an aneurysm. You get a balloon, kind of like a bubble in your tire when you hit a chuck hole and break the fibers in there. And so, Char, what causes ganglion cysts and Baker's cysts, a breakdown of those elastic fibers?
A lack of copper.
Very good, exactly, a lack of copper. So, what would you give this guy? How much does your husband weigh?
He's about 148, and he's 5'10".
148 and 5'10", so he's slim.
Yep.
Okay, so Char, what would you give him?
I'd probably start out for a while at least with 2 of the healthy bone and joint packs.
Perfect. 2 healthy bone and joint packs. Absolutely excellent. And the ganglion cysts go away. The arthritis stuff goes away. It might take anywhere from 60 to 90 days. You can try cutting him off the second healthy bone and joint pack and just get an extra bottle of glucogel so he's always taking 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. And I'd also throw in a couple of selenium a day. I'd throw in 2 bottles of selenium a month. That'll be 3 selenium twice a day, not because of the selenium, which isn't going to hurt him, but because it has the extra copper in it. Want to make sure that we're going to rebuild those elastic fibers in the tendon sheath in the wrist and forearm, and in the tendon sheath behind the knee. And so those things will shrink, contract when they get healthy, and the ganglion cysts go away, and the Baker cysts go away. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Billy, let's go to callers.
All right, Doc, let's head to Wyoming and Jay. Jay, you're on with Dr. Wallach.
Well, Jay, you're on the air. What's up?
Good afternoon, Mr. Wallach. Okay, I called in a while ago. I told you about my heart failure. Well, went back to the doctor, and they said the heart failure is gone. You know, I was taking the Beyond Taking Tangerine and the EFA, so that's a praise report. But I have a question.
Well, that's not. You want to slip over that so quickly. Was that congestive heart failure?
No.
What kind of heart failure was it?
I don't know. They just said that I had heart failure, but
how long have they been treating you for that? 2 weeks, 2 years, 20 years?
Since March of last year.
Okay, so not quite a year. And then how long did it take you to get rid of it, but with a supplement program?
8 months.
Okay, so you took the supplement for 8 months and then you declared it gone?
Yes.
Were they happy or surprised?
They were very surprised.
Yeah, there's a big difference between happy and surprised, isn't there?
Yeah. Okay, but I have a question.
Yes, sir.
Now, I've heard you talk to people about their turkeys, so I'm guessing you know about avian.
I know a lot about turkeys. Government's full of them.
Okay.
Medical system's full of them.
Okay. Well, we have.
Seriously, I am an expert in turkeys.
Okay. Well, we have a parrot that we bought, an Amazon parrot, and we just found out a couple of days ago that he has liver disease. What can I give this bird? I mean, he only weighs like a pound.
I understand.
But,
well, here's what I want you to do. Here's what I want you to do. I want you to get, we have a product called Arthrodex. Okay, it's a powder. It's designed, and we used to raise parrots and those kind of birds, hyacinths and so forth. So we raised them, particularly my son, Steve, used to raise them, and we couldn't do it without Arthrodex. So what I want you to do is make Arthrodex available for that bird. Just put a scoop of it in a little dish inside of his pen, his cage, and he'll lick it. You can actually sprinkle some of the Arthrodex, just like, just a quarter of a teaspoon in the dish that he has his seeds. Just spread it over the seeds, and then put another dish on the side with a scoop of that Arthrodex in there. He's also going to need some of the EFAs. If you got liver problems, he needs to get some EFAs. And so what I would do, in addition to that little bit of Arthrodex, it comes in a canister, has all the known essential nutrients for the liver except for the omega-3s. And so what I would do with that is the omega-3s, I'd go ahead and take a Q-tip with omega-3s and the EFA pluses, puncture the EFA pluses and squirt some of that EFAs on that end of the Q-tip and stick that into the cage so he can actually lick the omega-3s off of that Q-tip. Okay?
Okay.
All right, so that's what you do for a parrot. He'll do very fine. So we know, see, parrots, all vertebrates, including birds, require all 90 essential nutrients just like us. And just giving them seeds is not enough because it depends on how many minerals are in the seeds, where the seeds are grown. Because nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like chocolate and chocolate ripple ice cream. So some seeds might have 3 minerals, some might have 18, some might have 25, some might have 40, some may have 60. And so they may look alike, but the nutritional value is different. You got a lot of calories in seeds, but the nutritional value is going to vary significantly. So that's why we want the Amazon parrot to have the Arthrodex, which is going to give a consistent amount of minerals and amino acids and vitamins, but he's also going to have some omega-3s, and that's why you want to puncture one of our omega-3s, the CF pluses, and squeeze it onto a Q-tip, and he will probably get used to licking it off that Q-tip. Otherwise, just paint his beak with it, and he'll lick it off himself. Okay, well, thank you, everybody. Really great questions and testimonies today. Thank you so very much. Thank you, Shar. Super job. Thank you so much, Billy, for being Billy and Billy doing the call straight again, being the producer. Thank you so very much. Superlative job. And thank you, everybody. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.